Czy mięśniaki macicy to częste schorzenie? U kobiet w jakim wieku występuje?
Uterine fibroids are a very common conditions around women because more than half of the women will have fibroids that can affect the quality of life due to heavy bleeding, abdominal discomfort, and it can also decrease the reproductive functions. And it's very frequent until the age of 40 and increase until around 75% about the age of 50 years old.
Co zawierają aktualne europejskie standardy leczenia mięśniaków macicy?
But we have three big, I will say, types of treatments. Will be the surgical procedures, the non-surgical procedures, and the medical treatment. In the surgical procedures, you have also conservative treatment as myomectomy by hysteroscopy or laparotomy, meaning opening of the abdomen, and the radical treatment, unfortunately, is the hysterectomy. The non-surgical non-surgical procedures are uterine artery embolization, but it is not recommended for women who still wants to get pregnant, and also MRI guided focus on ultrasound. But all these procedures are still on trials. And we have also the medical treatments, and we have first of all them the GnRH agonists. We can decrease the size of the fibroids, but by inducing an amenorrhea and a menopausis, so with hot flushes and bone resorption, the treatment lasts more than 6 months. And we have the new SPRM, which is selective progesterone receptor modulator, and the new ulipristal acetate, which is linked to a very effective medication. We can decrease the size of the fibroids. We can stop the bleeding in 7 days, and 80% of the patient will have an answer while preserving the quality of life, and it's a very safe treatment.
Jak w wyborze metody leczenia uwzględnia się plany macierzyńskie pacjentki?
Of course, the choice of the treatment will depend on the age of the patients, the severity of the symptoms, the place of the fibroids, and the type of fibroids, and the wish to preserve the fertility.
Czy stosowanie farmakoterapii w leczeniu przedoperacyjnym mięśniaków jest w Europie praktyką powszechną? Jak wygląda dostępność do leczenia farmakologicznego w krajach Unii?
I think this new treatment is preoperative. It's available in all Europe, but some of gynecologists prefer first to go to surgery, which is, to my mind, not a very good idea. Because with that kind of pre-treatment, we can have very important effect, which is first the control of the bleeding. And for those patients who are anemic, we know that performing surgery on an anemic patient is very dangerous because it increases the rates of complications. So we can use this treatment for preoperative with the advantage of correcting the anemia, and of course we have a decreasing size of the fibroids. It's clearly an advantage for women first, and then of course for the surgeon if the surgery remains indicated.
Czy zastosowanie leczenia farmakologicznego i zabiegów mało inwazyjnych daje kobietom szansę na zajście w ciążę w przyszłości?
I will go further because if we do surgery for fibroids, there is a risk for the further pregnancy of a scary uterus. Women have to do surgery before getting pregnant, which is not really an ideal situation. But with the pharmacological treatment, we know that a lot of women won't have any surgery after the treatment because the fibroids are decreasing size and are not related to the uterine cavity. So the most important point is to me that 80% of the women will have an answer, and most of them won't have any surgery. Okay, because when you get to the 20% of patients not responding to the treatment, we will surely decrease the number of the surgery and of course decreasing the number of complications related to surgery after pregnancy. So I think that for young women, and especially young women who are wearing some fibroids and with the childbearing, it's clearly an indication for the pharmacological treatment.